Good morning, and today I'm going to be giving you post-operative instructions for oral surgery. We are going to give these instructions to the patient before and after the surgery, and after we can go ahead and give them a copy as well, because we know they're not going to remember everything. And if they have a caregiver or someone who's with them that's helping them with after the extraction, we can, with the patient's consent, we can go ahead and give them a copy as well, only with the patient's consent. So first we're going to go ahead and have the patient bite on a 2x2 or 4x4 gauze for at least 30 minutes. It applies pressure and promotes and helps the blood clot. And if the blood doesn't clot or if the socket is dislodged, the patient can develop alveolar osteoitis, which is when the nerve and the bone is exposed and the patient is in a lot of pain. And it takes about 2 to 4 days for it to actually develop. It's not going to take about 2 hours or 10 hours. It takes a while for it to develop and for it to show and for the patient to be in pain. And then no rinsing or spitting for 24 hours or sucking on a straw, because the motion irritates the socket and actually would probably promote bleeding, and we want it to form a blood clot so the patient doesn't bleed too much. So if you're drinking something, you could just drink it from the spoon, or you could just drink it straight from the cup. And no drinking super hot beverages. Warm is pretty good, but not super hot, super hot coffee, super hot tea, super hot water, or nothing like that. We want to keep the area clean, and we want to be gentle with the area, especially when we are brushing our teeth. We want to still brush your teeth, but at least be very gentle with the area. It is an open wound. We are trying to have the blood not flow so much, and so it's very important for us to keep it clean and then be gentle with it. And then no smoking or drinking for 24 hours. Smoking has toxic additives in it, which can irritate the socket, and maybe an infection can grow from smoking a lot. And then I said, this sucking motion of when you smoke irritates the socket, which we don't want. And then alcohol is a blood thinner, and then alcohol as well, when you mix it with medications, usually makes the medication not active. And so if they're taking painkillers or pain medication and they drink alcohol with it, it's not gonna help. And so no drinking. And then avoid spicy, sharp foods and hot foods as well. Like I said, soup. Warm is fine, but super hot soup can irritate the socket, and we don't want that. Sharp foods like Doritos or chips, just chips in general, they can poke the inside or maybe even get stuck in the socket and irritate it, make it bleed. I know sometimes when I chew Doritos, I accidentally poke my gums and it hurts super bad, and yeah, we don't want that. And then no excessive exercise for the rest of the day. One, because while you're doing weights or you're running, you're making your blood flow, you're making your blood pump. Your blood pressure goes, pretty high. And you just went through surgery, you're tired, you're on medications, and so you should just rest for at least 2 to 3 days, but I'd say just wait a week just in case. No aspirin for 24 hours. Aspirin is also a blood thinner, and that's why even we have to check their health history, because if the patient is already taking aspirin and we do an extraction on them, they're going to be bleeding a lot, and we don't want that. We don't want them to bleed during, and we don't want them to bleed a lot after. And if the bleeding continues, you could try a cold tea bag over the socket. I know the tea bag will soothe the pain at least and the irritation, especially green tea bags. And you know, I think that'll, like, you biting on it or putting pressure on it will one, ease the pain, promote the blood clot that we need, and overall help heal the wound. And then we're going to be applying ice packs and heat packs. We can apply them 20 minutes on, 20 minutes off. If we leave the ice pack on for too long, or we think that putting an ice pack on all day, you know, is a good thing, no, it's actually a bad thing, because it'll make your blood flow, it'll make your blood going, because the area is so cold, and then it'll actually not help you form the blood clot. So you could do ice one day, 20 minutes off, 20 minutes on, and then we can go ahead and do heat the next day as well, 20 minutes on and then 20 minutes off. And then remember, with always changing out the gauze, sometimes patient gets scared because there's so much blood, when really it's, you know, a saliva and our blood mixing together, which can make it look like the gauze is soaked in blood. However, it's not. And so it may look like bleeding, but it's not. But if there is a lot of bleeding and it's just not going away, go ahead and call the office immediately, especially if you have any questions or concerns. There should be the doctor's name, the doctor's email, and then the doctor's phone number as well. And then we can even give the doctor the patient's phone number, so the doctor can check up on them either that night or the next morning, but the next morning most importantly. And then the extraction site might ooze for a couple hours. Heavy bleeding, like I said, it's normal, but it's not normal at the same time. We don't want the extraction site, you know, to get infected. You know, there's, like I said, there's going to be a little bit of blood, a little bit of ooze. But, you know, when too much is, you know, there's an issue. And then, of course, there's going to be just a little swelling. If there's a lot of swelling, that is not normal. But a little bit of swelling, yes, is normal, of course. And then take your prescriptions as needed, whatever the doctor gives you, of course. And call the office immediately, like I said, if you have any questions or concerns. And going back to taking your prescriptions, especially if there's an active infection that you have, you need to make sure you're taking your medications. And then if you have any questions, go ahead and ask them. Call, like I said, or email. And your doctor should follow up with the patient the next morning. Thank you.